Good afternoon, everyone. Welcome to our pool reporters once again. Thank you for your understanding, the collaboration amongst the media to social distance and share. To Minnesotans, good afternoon to you. Yesterday we obviously had an announcement of one of the pieces towards making sure Minnesotans are safe, making sure that Minnesotans are healthy, and making sure that our plan to carry things out to keep people moving in a direction where we can start thinking about what the future looks like. I thought on the way over here today, and I think it seems almost unimaginable. It's been 4 weeks since our stay-at-home order. Minnesotans have done what was asked of them as well as any place in the country, and that's based on data, on the number of the flattening of the curve and where some of our numbers are at. I also thought about one of the things every day that's both the bright spot of my day and one of the hardest things I do. Minnesotans sitting down and writing notes and sending letters over. And I'll give all those to the Historical Society because I think someday when we look back on this time period, which they certainly will, and wonder how Minnesotans were thinking. And it's their joys, it's the things that they're thinking at home. They pour out their fears, their angst. They're concerned about their businesses. They talk about all of the things that this has done. And the one thing that the thread that runs through all that is the hopefulness of Minnesotans, the belief that we can do things differently. And today I want to spend a little time at the beginning of this to kind of broaden this discussion out. We've talked a lot about the lanes we're in. You've all become familiar with PPE and social distancing. As I said on my State of the State, those are things we didn't even talk about, last year, 6 months ago. Now all of a sudden they become part of our everyday vocabulary. But those are one lanes. Then we talk about, we're joined today by Commissioner Ricker on education, and we're going to make some announcements on schooling. We're going to talk to a family-owned business that has been a touchstone of Minnesota for 75 years, and how all these things play together. And the theme that keeps coming back to me, both in these letters and what I see in the data and the facts, is Minnesota has handled this in a very Minnesota way. We've stayed home, we've social distanced, we've flattened the curve. We've brought businesses and government together to build partnerships around how do we get PPE. We brought hospitals around and used the institutions that have been invested in by generations of Minnesotans, like the University of Minnesota, all of our healthcare systems, Mayo, Hennepin County, all of those, to do something that hasn't been done in another state, and challenged ourselves to do it. And so today I want to spend just a little bit of time in talking about just what all those things mean together. Again, I come back to this. Minnesotans, you stayed home, you bought us time. We've worked with hospitals to increase our surge capacity. We've partnered with the businesses, as I said. And what you see here, and some of you are familiar with this is on the dashboard that we launched about 2 weeks ago. It is well over 1 million hits of people going on here. It gets hundreds of thousands of hits a day as people see what we've done. How many masks do we have now? How many beds do we have now? How many critical care units do we have? How many could we have in 24, 48, and 72 hours? This was part of the preparation. It came at a huge sacrifice. We are all very, all too familiar with that sense that's there, the cabin fever that's getting at us, the sense of dread about our businesses and our jobs. But it was a strategy that will protect our neighbors. It's a strategy that will protect our hospital system, and it's bought us the time necessary. And we've learned. We learn every day about this virus. Sometimes we get good news. Sometimes we hear news that's not so good. We hear potential promising therapies, and then those might not happen. But the fact of the matter is we're learning, and we're approaching it, and we're in a state that has the capacity to do exactly that. It's certainly changed how we do things. We're going to see infections increase. Commissioner Malcolm's going to talk about this today. This is not unusual, but it's a thing that I dreaded. I dreaded it on the night of the State of the State because there was a line in that speech that said, we're going to see infections increase, we're going to see people get sick, and we are going to see people die. That was inevitable in a pandemic. The numbers showed that. What we could do is not to be at the mercy of this virus. We could do all we can to make sure that it was lower and fewer. But the fact of the matter is today, as you're going to hear, we're going to have the highest death total and the highest number of new cases. The thing I would just remind everyone about is the sheer numbers that you're going to see are going to go up significantly because of our testing. The real critical piece is how many people's lives do we save and how well is our hospital system be able to take it. So as we start to report these things, I hope you start to think about it. We're going to go from 200 new confirmed cases to potentially 1,000 or more once this starts to go. The question will be how many of them ended up in the hospital, and when they did, was the care there for them? This pandemic has created real challenges. It's exacerbated racial and economic disparities. That is just simply a fact. It has also exacerbated geographic disparities. It's something we've talked about in this state for a long time. I talked a lot about it around One Minnesota, that our diversity of geography, our diversity of economic opportunities, our diversity of cultures is our strength that made us strong. But what we've all known is that there was a softness underneath that that could cause problems in those communities. So we still need to buy. It's still hard to buy everything, but we're getting there. We need to turn over every stone we can. But I want to, again, after yesterday's announcement, there is no silver bullet, but there are things that we can put together to do this the Minnesota way, and that's what I want to spend a little bit of time of talking about. Everything we do has a trade-off. That is simply the way it is. So at the center of our decisions, when we talk, you've got used to that. Social distancing, COVID-19, distance learning, new ways to make safe workplaces, all of these commissioners and all the people out there listening at this. But at the heart of this is people. It's Minnesotans. And when these teams that are assembling, making the decisions that are impacting your life, I can assure you that at the center of that discussion is how do we make sure Minnesotans can live healthy, safe, and happy lives? And I don't choose that term happy as just to throw it in there at the end. It is very difficult to be happy when you're afraid of losing your business. It is very difficult to be happy when you wonder how you're going to pay your rent. It is very difficult to be happy when things that you have prepared your whole life for get pushed off or get canceled. So those are pieces that have to be included. So when people are having this conversation and you're all having it, as we think about the health and the safety piece of it, where do the other pieces fit in? Where do the economic pieces fit in? And how do we make sure when we're doing those trade-offs that there is a level of risk that is acceptable in terms of making sure we're not putting the most vulnerable at risk, making sure that we're not taking shortcuts that let this thing get a hold and burn back through our community, but also understanding that we knew this from the beginning. Jan Malcolm talked about it. Dr. Osterholm talked about it. This was going to be a marathon. You may not know it by looking at me, but I am a distance runner, and I still do that. And what I know is that half marathon or marathon is not indicated by that first mile you get out. Oh, you got out fast, you got a good time. It's going to be a long haul. And I think for all of us to understand, in that long haul, we're going to have to strike that balance to keep people healthy, safe, and happy as best we can about maintaining the things that we know will bend that curve, keep people safe, but yet keep people functioning the way they need to. So we're slowing the spread. We have to build immunity. You're not going to eliminate this thing. You heard Dr. Osterholm. You've heard Commissioner Malcolm. You heard Dr. Fossey, Dr. Burks. It doesn't matter where you go. The preponderance of the evidence is this is going to take time, and it's going to be like so many of these types of infections. It's going to take time to build up the immunity, making sure that those that can weather this do so, but those that cannot are not put at risk. So protecting those frontline workers, ensuring our healthcare system is ready to go, and then gradually moving Minnesotans back. If I can leave you with anything today, safely and slowly resuming things. Just to be clear, we're in our stay-at-home order till May 4th. Nothing changes on that. That's what's giving us this time. It's moving us in the right direction. But we have to quit thinking about this, that somebody's going to say something, we're going to flick a switch. It's the clearest question, and it is the most beautiful questions that come from the children who write me. To the young woman who named her dog after me, I'm taking that as a compliment, so I appreciate that one in that. But the young people who ask the simple question that all of the reporters in this room will ask, when is this going to be over? And it feels like it is going to be, again, the moment that it's over. I think we have to acclimate ourselves to the fact that this is that continuum and this is that dial turning. This is the dial turning as we go back. And the dial is going to, at times, move in both directions. So I want to be clear about that this is a critical component of this discussion because Minnesotans' well-being is going to fit into that very clearly. I'm asking you, stay home when you can. Continue to work from home if that's a possibility for you. Don't make unnecessary trips. Do the things that are necessary. Where your physical presence is critical, we have to start thinking about how do we do this? How do we move into a way that lets us view this as a marathon that is sustainable over a long haul? Because it was very clear early on, you could shelter in place, which some countries are talking about, which I don't think is sustainable, shelter in place till we get a vaccine. I don't think that's sustainable, and I think there is a calculus in that of damage that comes with that needs to be factored in. So the folks who are bringing that up, I want to be very clear, that is not a disrespect or a callousness to putting other people at risk. It's part of an equation, and I think we would all do better if we continue to talk that way, if we continue to think about this, that it's not the either or, it's somewhere along the continuum. And I think what I have come to the conclusion of, and this may be the genius of each of the states, I think we should have a much more coordinated strategy, but when we don't, the state of Minnesota is very capable of implementing a Minnesota strategy. I think we proved that yesterday. We're going to continue to weigh the very real economic impacts of this decision. We're going to work towards long-term protection of at-risk populations. We're going to identify, test all symptomatic people of every age, race, income, and zip code. We can't leave anybody behind. That was the goal in doing this. That will help alleviate some of those things that we're seeing of the disparities going. For everything setting that reopens, there must be a detailed plan. So I'm going to talk to you about what we're thinking about here. Whoops. Factors to consider. This is the chart and the thinking that we go through and how we use this of figuring public health, figuring social distancing, and figuring well-being. And if you look at the middle of the diagram of trying to get a healthy, functioning, somewhat semblance around normalness that we can continue down this marathon path till we get to that vaccine or therapeutics. So some of the key questions, if some of you are looking at this, and we'll put this up on our website or get that out there to you, everything we talk about in public health, we listen to the public health people on this. We listen to the experts, and this is the questions they ask. How does this impact a possible spread of the disease? How prepared are we to test, trace, and isolate those in our community that are exposed? Are our hospitals prepared to treat patients? And how does this impact public health for non-COVID illnesses? That's a pretty complex matrix there that they're trying to look through, but those are the questions that have to be asked. And what we mean by it, like on the last one, how does this impact public health from a non-COVID illness? This is a question Commissioner Malcolm has asked often. Don't forego treatment that you need. Don't forego going in. But I mentioned it this morning. We have to think about these elective surgeries fall back to that happiness of life. If you're waiting to have a hip replaced, your life is not happy every single day. And the reasons that the hospitals asked us to put the moratorium on elective surgeries, to do that first slide I showed you, is to build the PPE to make sure when the surge and the need comes, we can simultaneously do both. And that's what we have been thinking about. So during this 4-week period of staying home, of the angst, the frustrations, the things that are happening to all of you, this work behind the scenes has been asking these questions and then moving on them because of that. To make sure these things in this first set of public health gets answered, we absolutely have to have hospital capacity, we absolutely have to have the PPE necessary, and we absolutely have to start drawing data on what else is being impacted. Social distancing. Can you effectively social distance when doing this action? And we're thinking about this. Take, for example, golfing. That was the question to be asked. Why can't golfing be open? Where are the things that were there? How many people will congregate together? If you can do golfing, can you do baseball games? How will those work? These are some of the questions. Do we have the supplies needed to keep workers and customers safe? How big is the gathering and will people be safe? Are the settings predictable in how people gather? You're going to see more of this. Predictable settings versus unpredictable settings. A predictable setting is a factory with set workstations that have been cleaned, that have protective equipment on people and know exactly who touches the product and where it goes. A very unpredictable setting is a baseball game with people getting up to go to the concession stand or the restroom while they're amongst a lot of people. Those are two very different predictability levels, and it impacts how we think about what can social distancing do, again, to make sure that we are not moving away from public health because of what we're doing with social distancing. Or the third thing, social distancing too much where well-being is impacted. So the questions we've been asking, will this action we're doing actually help spur an economic recovery? If we're going to ask something, and if we're going to move in a direction or take a risk, will this spur economic activity? Does the action promote the mental health and well-being of the public? Does this action encourage our communities to return to civic life in a thoughtful manner? And does this action have meaningfully improved the lives of people? So you could think about it from golf. You could think about it from the parks. You could think about it from businesses going back and what it means to them. Can it meet these criteria? And our answer is what we think is, in essential businesses and things that we've done, that there may be a Minnesota way with testing, with PPE capacity, with social distancing, that you can start putting more into that middle section where it meets the criteria of social distancing, public health, and well-being. Now, here's I'd like you to think about this. The first thing when you look at this slide is I want you to go to the bottom. Throughout this entire process, these are things that will not change. These are the constants. Safe practices, washing your hands, stay home when you're sick, social distancing, masks that I see and all of us are doing outside. And then COVID-19 response. We have to be able to test, trace, isolate, build needed hospital capacity, and continue through this whole process to procure the things necessary to keep the most important thing in this chain functioning, the providers of health care. We cannot have a cascading effect where we lose providers. We cannot have a cascading effect where those that are taking care of us are too sick to do that. That's what you've seen in places where things have gone bad. And then I want you to move to the top, and this is how we're thinking about it. If you look on the left side of the slide with workplace settings, this is what we're talking about, a dial as it moves. If you notice on the bottom, critical services or smaller and highly predictable settings. As you start to move up that dial, you're losing some of the predictability of what will happen. So you could get maybe up in the way where you have people cooking in a restaurant or people running a business and delivering wearing gloves and masks out to the curb to deliver their product. That is a little less predictable, but it's on a dial where we think you can start to move to. You are certainly not going to, and I mentioned this yesterday, you're not going to jump. When I saw last week Nebraska was talking about opening a mall, I'm really glad that they decided the next day that was not a great idea. Because if you look at what's happening, that is a larger, less predictable setting in workplace settings. So when we go back to the slide you saw before, trying to figure out when do we move the dial is going to be predicated on, can we answer those questions about it? Same thing with social gatherings. And this is the one that I get this is the hardest. The safest place, the most smaller and highly predictable setting, is a stay-at-home order. And we implemented that. The dial is turned down quite a ways. And the reason for that, once again, was stop the spread, build the PPE, build the hospital capacity, and plan for testing and moving away from that. What will start to happen is you will start to see it move up, where you can have smaller gatherings where we were originally at 10 people gathering together. Start to get it where we can social distance in places of worship where they maybe have more room. I think most of us know the backyard barbecue with 50 people hanging out, the large sporting event or concert, those are highly unpredictable. And no matter what you do, the social distancing is very, very challenging. So I think what you would expect, we're not looking in Minnesota that there is going to be a point in time or a number that says if you do 6,218 tests, and Jan Malcolm says that we've seen a drop of 3 cases every day for 14 days, that means everything can open up. That, we don't feel that makes sense, because we also think there is the potential, and this is what we're going to talk about today, we think there's the potential that you can move that dial without some of those hard set facts. We also know when the testing starts to show us, we may have to be prepared to move the dial back down again. This is the debate you heard yesterday about the fall resurgence in conjunction with flu. may start to cause those same problems, which is, of course, an overcrowding of the hospitals, a lack of PPE, and the need for more ICU beds. But at this point in time, those are how those two work. And then, of course, school settings, distance learning till in-person school learning. And this is a snapshot of where Minnesota is today. It's a snapshot of what we've done. And again, if you viewed it as an on-off switch, stay at home was never needle's bottom to the left. It was never that. 80% are working in critical business and have gained us valuable lessons. You're going to hear from Bob Riegelman in a bit, a business right across the street that's very similar to his that was deemed, for right reasons, an essential business. He can practice the same exact things they're doing and be able to do his business. That seems to us to make sense where that dial could be able to turn. But those who say you flick the switch, we're not going to peg out to the right, because no matter how much you wish that would be a good thing, what would happen is we know the virus would skyrocket, we would overwhelm the system, and we would lose the lives that we have so far protected. So here's what the state's going to do. We're meeting with stakeholder groups, whether business, nonprofit, and other organizations, to discuss their unique dynamics. We're creating templates of preparedness for use by responsible entities tailored to each setting. You'll hear about one in a little bit. Provide opportunity for public comment on draft of these templates. Just to be clear, this is not setting up. This is not, and Commissioner Leppink does not have the capacity to go out into every business immediately. What we understood is the unique nature of this pandemic is that the partnerships that we're developing and the things that we've seen working and the areas that we know are going to be a challenge, congregate living centers and congregate businesses are making up the bulk of where we're at. So the people who are saying, my Ace hardware store in Wilmer, I can control the number of people per square foot in there very tightly, I can disinfect, is there a plan where that makes sense for us to be able to operate? Because these logical things that you're hearing people say is, why would there be any less risk in this setting than there would be in, say, deemed an essential business like a superstore, like a Walmart or something like that? Those things are absolutely what we're asking and the questions we want to answer, and we think that makes sense. Rather than saying, nope, no non-essential businesses can function, there's going to be some, as I'm just saying. I wish I could even envision when we're going to be back in a crowded stadium, but that is at the end of the marathon. Right at this point in time, there's some opportunities. Responsible entities will create a preparedness enforcement plan. They'll sign, or certify those. They will obtain necessary supplies, the mask and gloves that they're working on. Some of them are already thinking about way down the line, as Bob was talking about. He'd like to be able to have the capacity to be able to test all his employees. That's exactly the type of thinking we want to see people do, and it's exactly the type of capacity as a state and nation we need to have more certainty in getting people back in. Instruct customers on required safety. We all have a responsibility to this, not crowding into a store, not touching everything, being cognizant and changing your behavior. Effectively supervise and monitor these plans and create a plan for closing down, sanitizing the setting if a surge flares up. This is what we're going to see. We're going to need to be able to do that. That's that needle changing up and down. All right, we're slowly getting used to the practices that have to continue. I can't stress enough, we are not lifting today the stay-at-home order for May 4th. What we're saying is all along on this, we are learning, we are adding new tools into this fight. We're adding new partnerships. We're learning every single day, and we're building ways to get to that point where we can keep people healthy, we can keep them safe, and we can start to increase that happiness factor and that idea of taking off the economic pressure off of them by seeing what is possible. Wear face masks in public. We have not mandated this. I will continue to say this was somewhat debatable early on. The fact of the matter is that it doesn't make it worse at this time to spread it. I do it. I would ask all of you, I think it builds the sense of confidence in us that this is working. We're seeing a psychological effect that I think we're going to start to see some data behind it. When you have the mask on, there's a sense of naturally being cognizant of social distancing and the way that you're interacting with people. We're going to symptom screen, temperature check, maintain physical distance from each other, and again, I say this, the things that we love so much are going to be hard to do. All right, our plan for moving forward. Stay at home remains in place till May 4th. We'll make a decision on this. We wanted to do this because we have done it the whole time. We have seen this as a dial. We have seen Minnesota's ability to be flexible, that it was never a stay-at-home order that was a stay-at-home for the sake of staying at home. The stay-at-home order was being asked and answered for those first set of questions that we had up there. Is it doing these things? Is it getting to there? If the answer was not, we had to ask ourselves, why are we doing it if it is not getting to that? Or if we're seeing things start to spring up hotter, why are we not doing more in those areas? That is going to continue to be exactly how we function and continue to move. So it is not a point in time that is frozen. It is an ever-changing and evolving place. But I am telling you this, by cutting down unnecessary travel, by staying home and the sacrifices you make, have put us in a position where we can start thinking about how do we start turning the dial and normalizing some of the things that have been taken away. Our testing is going to be critical. Jan may mention a little bit of that. And I'm going to announce here in a minute, we're going to be extending the distant learning throughout the rest of the year. And I know Commissioner Ricker is here to answer any questions on that. And we're going to try and safely allow the folks we can to get back to work. Yesterday, we launched Straight Right Strategy to expand this, that partnership you've heard about. I'm here to say on behalf of Minnesota again, thank you to all of the players that are involved in that. This gives us a fighting chance. This gives us an opportunity. Slow the spread of the virus, help identify folks, jump on the hot spots early. And what's also happening, and I'm glad to see this, Vice President Pence is going to be visiting the Mayo Clinic this week talking about some of the research. We are at the center of most of the work that's being done around this right now. So this is good news, Minnesota, and it's what I asked of you. I asked us to step up and lead, and that's what we're doing. Here's the announcement on distant learning. And there is no joy in this, but there is an awful lot of thanks to everybody involved. The first thanks goes to the students. And I want to speak directly to the class of 2020. Those of us who are older, think back fondly to those. This is, in that school career, these are those times. These are the times when you forge friendships with people you maybe hadn't for 11 years. I think many of us would say how interesting that is, the folks in the last 3 or 4 months of your school career that you started to bond with and see. You started to think about what the next phase of your life was like. You started to see yourself, and it's a rite of passage that you were adults. You were young adults, and you were being treated that way, and your future laid out in front of you. It feels like that's been taken, and it has, from you. None of us ever had to go through that. We had the privilege and the luxury of being able to do all of those fun things, end our sports careers on spring sports. But here's what I do know. This period in time, you will be forever the class of 2020. You will not be defined by staying home and missing proms and missing graduations. You will be defined by understanding how interconnected our world is and what it means to come together to try and solve hard problems. I would venture to say that the closeness of the classes of 2020 will be much closer than any other that came before. This ties you together in a way that has not been ever seen. And I just want you to know that these decisions being made, they break our heart. To the teachers out there, thank you for everything you're doing. I know what you're losing. I think about those of us who do this job, those moments of epiphany that happen in a classroom, the class discussions on a lesson that go down a road that sparks everyone's imagination, including the teacher, and you leave with a sense of wonder of what could be possible. Those are all being denied. You're learning new ways to deliver distant learning. And I also want to be very clear. This is not the perfect solution. I am proud of Commissioner Ricker and her team. I am proud of Minnesota's students, teachers, and parents, that some have just sent people home and gave them a list of homework or whatever. That's not happening, but I want to be very cognizant. I think someone at the department said this: there are places where we say, wow, on this plan, and then there's places we say, whoa. And I want to be very clear. We were having a very important discussion pre-COVID in Minnesota about inequities in our education system, a very important discussion. That has only been highlighted because of this. It is certainly falling heavily on communities of color, indigenous communities. It's falling heavily on rural communities because of the lack of broadband. So tomorrow we are going to do a much more extensive deep dive into what our expectations are. But today's executive order will continue distance learning to the end of the school year with modifications and I think attempts to try and offset what are clearly inequities that are being exacerbated by this. So we'll keep looking on that and keep bringing you back. But again, to the students, thank you for doing this. I can't express, I'm sure, the sense of loss you've had, but I would ask you to see your unique role. You're going to have a life experience that none of us had. It is going to shape how you think about the things you do in the future, and I, for one, am very hopeful about that. I think you're going to think with a forward lens to make sure that we don't end up in situations like this again. So currently, we have 2.6 million people working in Minnesota. Today's order was developed in consultations with hundreds of businesses, with labor groups, with worker organizations, and with the public health experts. None of this would be done without a sign-off of independent health experts about the Department of Health and Commissioner Malcolm and the autonomy to be able to help us adjust and tell us where and when we can go as a part of this. This will probably allow 80 to 100,000 more people in similar industries to start returning on Monday. You're going to hear, I think, about 100 of them or so from Bob's company that's going to go. So I'll let you look at that. To reopen, the business must create, share, implement a COVID-19 preparedness plan. They're going to work on all the hygiene, engage in health screening of employees, ensure that sick employees stay at home. I'll tell you, we partnered with Target to do anonymous ability to be able to track that health data. There will be no personal data, but inside the company, you'll be able to see of the 90 people anonymously on there, what's happening every day with their temperature, what's happening with their sickness. That's going to be a free app that's going to be supported and given out that makes great sense. It's one of the things epidemiologists tell us is going to be key to this. And continue to work from home, of course, whenever possible. So we're discussing things today about talking about who can work. I just want to pause for a moment. There are some people, they had not only no choice, they ran to the danger. They are the frontline workers that have been there, whether treating people at the point of healthcare delivery, whether they have been at the grocery store clerking for a month or more now in a time of a pandemic. They are all the people that work to clean the buildings and all of those frontline essential workers that, as I've said so many times before, in our society it might have been easy to see them as, or to not see them because they might have been invisible and they worked at night or you didn't see them. I think we know right now where the importance lies, and I want to just make sure that all of those people listening, nothing we will do, we are guarded against this, puts you at a greater risk. If it starts to do that, because of the moves we're making, we will dial that dial back, because it is critical for us that they have the equipment and stay healthy to deliver what they need to deliver. So here's what's next. Continue to test, trace, isolate. Continue to buy PPE, build out our hospital surge capacity, and protect those at risk. We've done a great job of that to this point. We've got more to do. We'll monitor closely and report daily to Minnesotans. Start turning the dial toward a more reopening as the factors come into play. We will not be driven by arbitrary numbers, and we will not be driven by arbitrary dates. We will be driven by facts on the ground and the capacity to do this in the Minnesota way. And always prepared. If we have to dial it back, we will. And even as we open, life's not going to look the same. So, Minnesotans, I want to take just a little more time because this is a conversation we're all having. It is not good enough to discuss these things in their lanes alone. We have to try and compile it so that it starts to look like the diagram of what does a healthy, safe, social distance, and economically viable state look like. That's what we're trying to do. And I think because of the partnerships we've built up, and I believe because of the way Minnesotans have handled this social distancing, we've got an opportunity to show the country the way it goes, the way it can go. So with that, I took a little more of my time, Jan. I just want to have you update them more today, and we'll have Steve and Bob. Thank you.
Thank you, Governor. I'm going to be extremely brief today and just give you kind of the quick fact update. Situationally, around the world, globally this morning we had nearly 2.65 million cases and 184,000 deaths. In the United States, over 842,000 cases and almost 47,000 deaths. And in Minnesota, sadly, as the governor said, I'm sorry to report that these are our largest growth totals day over day so far. We had an additional 223 laboratory confirmed cases yesterday, bringing our total up to 2,942. That is, again, laboratory confirmed cases, and a part of the increase that you see is because we are testing more. We tested about 600 more people yesterday than the day before. And you can only expect that number to grow. And as the governor has said, as we test more, we're going to find more, and that's the whole point. So just the fact that we're going to see the numbers grow, we should be prepared for that. We will continue to benchmark our progress against other states who, and we do rank at the bottom of the curve still in terms of cases per 100,000 people. But we don't want to rest on our laurels about that because we know that is influenced by the volume of testing. We're not doing badly for a population of our size, but we must do much, much better. Not only to find all the cases that are out there, but to go looking for the opportunities to intervene in hotspots really quickly, and to be able to support businesses that want to assure the safety of their workers as much as they possibly can. So I think those totals, again, are just something we're going to have to keep in context as we go here. Unfortunately, also, this was our largest day in terms of additional deaths in a single day. 21 additional Minnesotans died of COVID-19 yesterday. This includes 10 in Hennepin County, 3 in Ramsey, 2 in Washington, but also 3 in Winona, 2 in Olmsted, and 1 in Clay County. So the disease does continue to spread across our state. As has been the pattern, most of these are elderly folks, and 21 deaths in total. 6 people in their 90s, 9 in their 80s, 3 in their 70s, 2 60s, and 1 in their 50s. And 20 of the 21 deaths, once again, occurred in residents of long-term care facilities, which again is not terribly surprising. That's where we know the risk is concentrated in congregate settings, as the governor has mentioned. We're learning a lot of lessons from our work with some of the facilities that are experiencing this, and again, appreciate everything that the long-term care provider community is doing in the face of really difficult circumstances. The governor talked about the people going willingly into the settings where they're caring for people that they know are already ill, and how very important it is that we be able to test those workers, understand who's been exposed, to get them safe, get their contacts safe, get their families safe. But it also then creates a cascade of challenges around the workforce, the long-term care workforce. And we're grateful to see partnership from the hospitals and from other sectors trying to help us figure out how we can support the long-term care workforce, which was already under stress before this began. So just an awful lot of really, really important and good work going on across the healthcare continuum. It's not just hospitals, it's primary care clinics, community clinics, hospitals, long-term care, community-based services. All of these providers need our support and our thanks. A piece of good news, as of today, 1,536 patients have been released from isolation. Also, on the hospitalization front, you see the case counts going up. Sadly, you see the deaths going up. Hospitalizations continue to increase as well, but still at sort of a measured pace, and we hope that that continues, but we're preparing for a bigger uptick. 268 patients in the hospital as of today, but a slightly smaller percentage of that in intensive care. So we're not predicting that that will necessarily remain the case, but it's an interesting point. I think at this point, Governor, I'm really proud to introduce one of my great colleagues, Commissioner Steve Grove from Deed.
Well, thank you, Commissioner Malcolm. Hello, everybody. I want to begin just by sharing the numbers on unemployment insurance for today. As of today, since March 16th, we now have 536,742 applications for unemployment insurance. And just to give a little bit of context of that, we are now above the number of unemployment insurance applications that we had during the Great Recession. We had about 450,000 back in 2009. So we've moved beyond that peak during the Great Recession. This week, we've had 30,500 applications so far, and we continue to see a sustained downward trend in those applications. Again, we got ahead of this really early by opening up our system to those who are affected by COVID-19, but we do continue to see 7,000 to 10,000 new applications come in every day, and of course lots of phone calls. And we do encourage people to use the website, but you can call in, and we are here to help you out. Just stay in the line because it is a long wait time when you call in. I want to start a little bit more, tell a little bit more about Executive Order 2040, which the governor mentioned earlier, which involves the process of beginning this process to safely bring people back to work. And it is a limited first step. And before I get into some of the details, I want to talk a little bit about how we got here and how we got to this, how the governor got to this decision. Back on April 8th, with the Stay-at-Home Executive Order 2033, the governor asked the Department of Employment and Economic Development, the Department of Labor and Industry, and the Department of Health to begin a planning process for what the reopening of our economy would look like. And since then, we have talked with hundreds of business leaders and labor leaders across the state. We've heard from thousands more via an online forum. We've had a lot of different meetings. Twice weekly, we meet with every single chamber of commerce in the entire state. Twice weekly, we meet with all the major labor unions across the state to hear their feedback. Every single week, we meet with the Minnesota Business Partnership, which is some of those larger companies in Minnesota who give us great advice and thoughts. We've assembled a panel of experts on social distancing practices. We've engaged a human-centered design firm to help us examine what exactly the dynamics and settings should look like from a user perspective to make sure that we're thinking through social distancing really thoughtfully. We've got a panel of experts from business on economic security issues. And that online forum I discussed a little bit ago, that's taken in over 4,000 suggestions and ideas from Minnesotans across the state on how to get social distancing and health and safety right in a work environment. And it's just been extremely helpful to get those ideas from Minnesotans. All of that collaborative effort together has led us to the framework that the governor laid out earlier, and also led us to the Executive Order 2040, which he signed today. So that executive order, as the governor said, allows industrial, manufacturing, and office-based businesses that are not customer-facing to return to work beginning on Monday, April 27th. So the order is signed today, but doesn't go into effect until next Monday. We believe this executive order will allow about 20,000 businesses to go back to work. That's about 80 to 100,000 workers in the state who are currently not working. So they'll be joining the 2.6 million Minnesotans who currently are working. Now, it's up to every business to decide whether or not they want to come back. This is not an order to go back to work. It's just allowing businesses to go back to work, provided they meet some certain guidelines. And there's 3 broad guidelines that the governor has set up for all businesses to adhere to make sure that going back to work is safe and prizes the health of Minnesotans as its primary concern. First of all, every firm that is going back to work should continue to telework or work from home as much as possible. And we know businesses are doing that. They're figuring out new ways to engage in commerce with workers working from home. We highly encourage every business to continue doing that. Second, any business who comes back into the marketplace as a result of this executive order has to create a COVID-19 preparedness plan that follows very closely MDH and CDC guidelines and meets OSHA standards. All of these plans must include the provisions to ensure that sick workers stay home no matter what, that social distancing practices are followed, and that they're followed in the unique dynamics that are true to every particular business's physical footprint, that employee hygiene and service control or source control are there, and that there's a strong cleaning and disinfectant protocol in place as well. Now, to make this a little bit easier on businesses, my colleague, Commissioner Nancy Leppink, and her team at the Department of Labor and Industry have put together a really wonderful template that we've had online on their website throughout this week. We've been receiving some great feedback on this. It essentially allows businesses to take that template, use it as their starting point, and to create a plan that they would like to use for their business. They're not required to use that template, but it's a resource that we hope people do take advantage of to make sure they have the best plan possible for their workplace. And you've got some time to create these plans. Again, the order comes out today, but this isn't really effective until next Monday, so we know it will take some time to go through the planning that's required to ensure you're ready to bring employees back. And we really encourage businesses to work with employees on these plans. Not only are you going to get good ideas from your employees, but investing them in the process of building a plan for your workplace means that they'll understand it better, and you'll all be on the same page about exactly what your business is going to do as you begin this process of reopening. The team at the Department of Labor and Industry's OSHA division will be available to take questions if there's concerns or ideas, or you just want some help thinking about how to consider your plan, and they are there to help. Once you have created this plan, we're not requiring you to submit it to state government. We are not going to be reviewing these plans. Again, this is 20,000 businesses. That's, I don't think, a good use of government time, but we do want to make sure that you have that plan. And so to ensure that all your employees see it, we ask that you do sign it, certify it, post it prevalently around your facility, and disseminate it widely to your employees. And then, like any good business who we know is already taking care of their employees and thinking about the communication around this, do the training, bring people together, Again, we are not going to ask for these plans outright, but when we hear about challenges that may be taking places in workplaces, the state does reserve the right to ask to see a copy of your plan. And then the last piece of this is that all employers are required to conduct health screenings of workers each day upon arrival. The governor talked a moment ago about this new digital tool that Target has built, which is a wonderful piece of technology we'll be making available in the next couple of days. We have partnered with Target and the Minnesota Safety Council on this. It's really an innovative and simple way for businesses to be able to track temperatures of their workers over time. Optional for the business, optional for the worker, but just a tool that's there for businesses to use to track temperature over time. And then even more importantly than just the temperature screening piece of this is the health screening questions that CDC and MDH have put together every day when your employees show up, asking them, do you have a cough or muscle aches or other COVID-like conditions that are not attributable to, another health condition. And so that health screening part of this is really critical. Now, all these requirements that I just mentioned are in place for all new businesses that will be reopening under Executive Order 2040. They do not apply to businesses that are already up and operating. So I want to be clear about that. The requirements here are for these new businesses. But I will say that these ideas came from businesses who already are operating. We know so many businesses are doing the health screening. They have a plan. They're talking to employees. And so it was really the learning from all those conversations from businesses that are up and running in the critical sectors that we used to build this template and this plan for people to use as they come back into work. Just for some additional clarity on the executive order, it does not allow any customer-facing retail environments to reopen. That means that if you're a manufacturing or industrial business that has a co-located retail facility, that portion of your business cannot reopen. It's just the industrial and manufacturing pieces. And again, this gets back to the governor's comments on predictability. We know that in a factory floor, in a manufacturing setting, you can predict the environment and the engagement of workers on your floor. When customers come in, it's a very different dynamic. And so we are turning the dial slowly towards predictability to ensure that we get this right. And if you're a business that was affected by Executive Orders 2004 or 2008, or if you're a non-critical business in Executive Orders 2033 that's customer-facing, your status is not changed at all based on today's order. I want to speak just briefly to how this affects unemployment insurance because we know there's some factors here at play. This is, I think, welcome news, what we know, to so many workers out there and businesses who want to get back to work in a safe and methodical and thoughtful way and get off unemployment insurance and back into the economy. But we also know that people are nervous about that. It's scary to be off of work and be tracking this news about the virus and now be going back to work. And so it's just so important that businesses create really thoughtful plans, be really careful with their workers, and ensure that we take care of not only the physical and health safety, but the psychological safety of workers as they begin this journey. Unemployment insurance, it's a great federal program. It remains at its core a safety net. So for those who cannot go back to work, it's there. But if you're able to go back to work, you do need to do so. And the state cannot pay unemployment insurance benefits for those who are able to go to work. I think it's important and timely to remind ourselves now of Executive Order 2005, which did expand unemployment insurance to take care of workers separated from their jobs due to COVID-related reasons. That remains the law of Minnesota. So if you do need to take care of a loved one due to COVID-19, take care of a child due to school closures, or if you yourself are particularly vulnerable to the disease for medical reasons, you still do qualify for unemployment insurance. And we know that given the announcement both about school closings and distance learning moving forward and this economic announcement, a lot of folks are thinking about childcare. We know that that's a challenge. Our team continues to work to support childcare providers across the state. There is childcare open and available in Minnesota. The team in the Children's Cabinet has put together a great website at mn.gov/childcare. That site includes a map of open providers and a hotline for parents to call to find care. So we'll go into a lot more of these details later today and tomorrow in a couple of webinars. You can find them at a website that contains all of this information, mn.gov/deed/safework. We'll be doing a webinar at 4 p.m. today and then tomorrow again at 11:30 a.m. Again, mn.gov/deed/safework is where all this information is listed. Lots of frequently asked questions there to get into some of the details of these pieces. We want to make sure that all businesses and workers understand the implications of this plan. So moving forward, as the governor said, we're going to continue to use data and facts-based scientific approaches to reopening our economy, prioritizing the physical and economic health of Minnesotans. And it's going to take some time for life to feel anything like it used to feel. But we really feel like with a plan in place, government, business, communities working together, we can get this right for all Minnesotans. one of those Minnesotans who's been really helpful for us in really formulating this plan and thinking about how to get this right in factory settings is Bob Riggleman, who the governor mentioned earlier before. He is the CEO of Rydell Skates in Red Wing. Great company in Red Wing. He and his family have owned that business for 75 years, and Bob has been talking to us a lot about how Rydell Skates is thinking this through. He's been gracious enough to join us today to share how his business will be gradually reopening while keeping health and safety in mind. So I'm pleased and thankful to welcome Bob Riggleman to our press conference today.
Thank you. Thanks, Bob.
Hello, everyone, and thank you for having me today. As the governor mentioned earlier, our business is Rydell Skates, located in Red Wing. As Steve just mentioned, we are a fourth-generation business. Been here, this is our 75th year. The company was started by my grandparents, Paul and Soph Rydell. I've been with the company for a long time, for 43 years. And I can honestly say that in my tenure in 43 years, our company has never seen the likes of anything like this before in our history. But as painful as it is, and as it has been over the last 4 weeks, we knew that pausing our business for the health and safety of our friends, our neighbors, and our employees was the right thing to do. The safety and health of everyone in Minnesota is utmost importance. We've done all that's been asked by our governor, and now we're extremely excited, almost to tears, that with the governor's partnership, that we're taking a cautious step forward to reopen our business. We've gotten the guidance from DEED and from the Department of Labor and Industry how to successfully reopen our business. Our employees, our plant superintendent, our director of manufacturing, our HR director, myself, we're taking that guidance and we're building our plan to make the necessary adaptations to keep our employees and our customers safe, while all along getting our business back to doing what we do best, and that's building great product for our customers. Like all Minnesotans, business owners have had to adjust and adapt to a new normal. Not really sure what that new normal is going to shake out to be. It changes every day. And as business owners out there, you all know it's not easy, but it's the right thing to do. At Rydell Skates, I can guarantee you that we will continue to work with the governor and his team to make sure that the health and safety of all of our employees and all Minnesotans comes first. Thank you for the time today, and I'll turn it back over to the governor.
Thank you, Bob.
Thank you.
Thank you, Bob. I'm going to go back and look at that on the well-being, the social, all the piece of this. This is the broader conversation, and Minnesotans can figure out how to do this. And I think about it with a business like Rydell Skates, a family that put their heart and soul in this, and we hear this about the economy. There's also the aspect in that community, what they did. There are generations of people in Red Wing that bought houses, raised their children, went to Red Wing High School, experienced what life is like in one of the great communities in this state because they had the opportunity to work at Rydell Skates. Every business out there has that same story. So I want to be very clear. As we look to the dial, what we're asking is we're turning the dial slightly on workplace settings. But I want to be very clear. Those folks who are further on the dial have Bob's story too. They have those same things that are out that make those communities great, that brings pride into that and creates that economic growth. What we're trying to do in an unprecedented situation is create a Minnesota model that is able to find that sweet spot in the middle where public health and the social distancing, the changes we need to make, also can coincide with getting as many people in the well-being place as they can. I'm going to say, and I don't know if TV, how long they can stay. I will stay longer to answer questions because we ran a little longer. We wanted to go through this. And I do want to say we're glad to answer the questions on education, but we will focus specifically tomorrow on some of the deeper dive into that, but we're glad to take any questions. So,
Let me start on schools, if I may.
Sure.
Distance learning is going to continue to the end of this school year. You've directed the commissioner to put together some guidance on distance learning for the summer. You don't say anything about fall. Should parents be expecting to do distance learning this summer, and what should they be expecting about the fall?
I'll let the commissioner talk on that. And I think this is the question I think we should keep asking. The answer is I don't know yet on this fall. And I think it's because of the ever-evolving piece of this. I think we're going to learn a lot as we have. It seems unimaginable to me, this shutdown, and I'm sure, Bob, you would agree, has been 4 weeks because of the catastrophic cascading nature of what it's done. But I'm also seeing, as we add in the capacity to test, as we add in some of these things, we're changing the dynamic. So I'll have Commissioner Ricker talk, but just honestly, I don't know yet about the fall, but I'll have to tell you how we're thinking about this. Multiple paths at this. Think about what it looks like to come back. Think about what a potential hybrid looks like, because I can tell you, we know that there are students out there that we can do better with. I think the commissioner. So please.
Sure. Yeah. Thank you so much for your question, and I appreciate the governor keeping this slide up. My heart is really heavy today with this announcement because of the impact we know this is having on our students and their families, how badly our students want to continue to connect with their friends and their educators and in their school settings. And we know we are already thinking ahead to this fall, and quite frankly, we're not even just thinking this fall, we're thinking what the school year looks like. What does it look like to support students, both because of their experience they are having this spring, the experience they will carry forward, and then the talent and expertise and the readiness we want to make sure our school communities have to really support our students and their families and that teaching and learning environment. So these questions are incredibly important to us too when we consider meeting the needs of students in a brick and mortar setting. We have become so much closer to the Department of Health every single day. We keep our weekly phone calls with our school nurses so that we are constantly checking in on them. We are looking at all of the data they're bringing in, and we are looking at the evidence that students and families are providing us to just what are their frustrations, what are their challenges, and so we are not only committing to recalibrating this distance learning experience right now, also anticipating what it could look like this summer to support students and to support teaching and learning. And we are starting to ask some of those questions, work with some of our experts in the field, our educators, and continue to listen to students and families for what next fall could look like and what the whole school year could look like.
So this is going to be a huge lift for parents if schools are out in the summer, but especially in the fall. When are you committing to getting that answer to them on the summer and in the fall?
As soon as humanly possible. That's, I think, us announcing today is that I know people are already looking towards May 4th, what that means. We're trying to convey in real time. And I just, candidly on this, I think, I don't know yet what that'll look like. I think, there's potential game changers in this both ways. If this thing gets worse or if we get some therapeutics. So my commitment to them is also with a father of a 7th grader in the St. Paul Public Schools. I hear everyone out there, and this is difficult, and it's certainly easier for some families than others, but we have got to figure that out. I think the commissioner's commitment to this was our first month of delivery on this. We had those 8 days to prepare. We know that we have to continue to evolve and change this. So as soon as we can.
Governor, this is for you and also Commissioner Ricker, if you'd like to answer it as well. I'm hearing from school administrators, some parents are calling for schools to stick more to core classes like science, math, and English and drop some of the electives during this distance learning. Has there been any consideration to allow parents to opt to choose a focus more on core classes?
Commissioner, I'll let you, this question comes up amongst all of us. I'll let the commissioner, so.
In our homes too.
Yes,
right?
in our homes.
I really appreciate that question because I do know at the heart of that question is our educators and students and families creating distance learning plans that meet their school communities. They're, the one-size-fits-all approach for the entire state of Minnesota right now is focused on the safety of our students, the health of our communities, and those distance learning plans will live and die with how they are tailored to our school communities. And so it is listening to those frustrations and those struggles and shape-shifting and, quite frankly, keeping relationships with students at the center of any plan. And so I would caution any school community with making sort of broad decisions about core classes versus electives, because the one thing keeping a student connected to their school community may be that subject area that someone else is advocating to thin out. And so the more a distance learning plan is designed to shape its school community, the more equitable it will be for students and their families, and the more it will maintain student relationships at the center of that work. One of the things I did early on in the planning period was also encourage educators to cluster standards, so engage in interdisciplinary activities so that you could make better use of time with students while still making sure that you're keeping relationships at the center and meeting those academic standards at the same time.
It's a great question, though, and I think that's what we're learning. I told my seventh grader, the one thing I know for certain is geography will stay part of the curriculum, so that's personal. So. But it's a great question, and I thank the parents and I think the engagement that we're all learning. This is, it's an amazing learning opportunity after this is over. It's exposing strengths and weaknesses in our system that we need to see that.
Regarding academic standards, then, it is unlikely that students are learning as much now than they were in a classroom setting. Do you have any evidence that they're falling behind? And what are you going to do to help catch them up on their learning if they're falling behind? And are you holding them accountable to the usual academic standards in the first place?
I will say before the commissioner, because we've talked about this a lot and we're all talking about it, I worry deeply on this. I mean, these are decisions that will reverberate through a lifetime potentially. We know what educational research shows. We know what happens when you fall a grade level or two behind at certain times. So this is a question we're asking, and Commissioner?
Yeah. Thank you so much. I know one of the first things our educators did during that planning period was look at the menu of academic standards they planned to address this spring and really distilled them down into what the imperative standards would be they would address. And then they also looked at the sort of benefits they would get from, again, maintaining relationships with students, strengthening those relationships with students to make sure that students who had to leave their brick and mortar setting, had to leave their friends, had to leave their educational space, had to leave their educators, that they would still feel seen and heard and still feel connected to their school communities. And it's those things in many respects, before this, I would say that the strongest teaching and learning conditions meet the academic needs of students, the social emotional needs of students, and do so in a safe and welcoming environment. We asked our school communities to redesign that strong teaching and learning experience in a distance learning setting, meeting their academic needs, their social emotional needs, and recreating that safe and welcoming environment, no matter what space a student was in. So we know that if we keep relationships at the center, that there are going to be some academic standards that we're going to need to address next fall. And that's why I say, looking into next school year, it is an entire school year long expectation that we will have to continue to come back to meeting the needs of our students and making sure that what got on the cutting room floor this spring perhaps gets woven into what next fall looks like, and perhaps even the fall after that.
It's a great question, and it's one that this will be ever evolving. This has changed the way we look at it, the just grade level achievement and all of those things. So that's why I think tomorrow we'll make sure we deep dive too. We're glad to answer any more on this, but we'll do.
If I can do the flip side to these 20,000 businesses that will be allowed to reopen on Monday. Now that you're ramping up testing, and I have read in some other states where they're hoping for 14 days of decreasing positive tests before they start to reopen customer-facing businesses. What do you tell the customer-facing businesses here, because the amount of testing increase is going to show an increase in cases?
It will. That's a great question. In the White House opening of America, actually their first 2 points are rapidly increasing testing and then 14 days of going back down. We think the CDC guidance is critically important, but we also think the unique nature of each state warrants us taking a look at this. And I think what we're talking about is not just that point in time. And what I mean by that is we do want to see numbers going down, but we're not necessarily sure that there's a magic behind 14 days that in itself is going to stop the spread, or that in itself should be the gateway for that particular business. We think there is a more nuanced approach. We think there is a more public health approach as it intersects with well-being and social distancing, because if we're getting better results in social distancing, significantly better results than other states, the 14 number is arbitrary because we are doing more on that front end of social distancing than the 14 days coming down is. So what I'm telling them is to stick with us on this, continue to talk to us, that we believe the way to do this is to create a unique model to situations here, to testing here, to social distancing here, and to the spread of the disease as we see it, and adapt accordingly. So I would tell them that we're using CDC and MDH guidance, but we are trying to create a template here that I think is uniquely Minnesotan. So you're right, because we said that same question. When do you think you're going to see 14 days of downturn here? Seriously, if the models are inside their confidence interval, the soonest you're going to see that is the end of May, and the latest you might see it is July, before you would see 14 days down. What we think we can do here is through testing, identification, and social distancing, is change the curve. That would be one metric in there, not necessarily the most important metric, is it's going to be volume. Because again, I keep telling us, I think it's hard to wrap our mind around this. Mike Osterholm said it again yesterday, that we are slowly trying to build that immunity throughout. I think people saw it and they said there's no way that can be possible. Looking over the life of COVID, yes, most of us will eventually get this. That's just the way, or we will get a vaccine. One of the two things will happen for the vast majority of people. And what we're trying to tell them is that we're trying to craft something here in collaboration with health, businesses, best practices that can do something different.
Governor, the reason for the stay-at-home order, or one of the reasons you've often articulated, is buying time for the hospitals to prepare. One oddity when I looked at the state website was that there was 2,772 ICU beds available on April 6th. Today there's 2,638, actually less. For what reason, I don't know, but it raises a question. Has this time bought us what you want, or has it all just been a waste?
No, it has. It has. I would certainly, if you look at it, what we've done, it falls into that spread of range, because I think I want to be very careful. You pick one number in there and everybody focuses rather than it's broader. It brings us to the bottom part of it, but I also think as new evidence comes in, I truly believe we're seeing this, that we're spreading it out more. But I want to remind Minnesotans, the hardest days are ahead. The climb is still up. We are not near that peak yet, but we do believe it's there. But we had this conversation this morning with the healthcare executives to understand exactly how it is, to continue to stay on top of that and continue to look for PPE. But at this point in time, I've heard other governors say this, and this is my commitment. I've told our team, I cannot have a single person who needs an ICU bed or, God forbid, a ventilator, not get that. If it's going to be, those are hard fights regardless, so we have to make sure that that's there. So at this point in time, I am cautiously comfortable, but I'm not going to kid you. The fight for PPE and things is still a fight. The other side is that we have the capacity on these alternate care. Joe Kelly's done a great job with the Corps. We're ready to expand out even more. The question will be the workforce, and we're still having that conversation of doing some things of how do we attract more workforce. The question has come up about reciprocity from states that have excess workforce coming over. Those are very valid questions. But I would tell the people of Minnesota today, I am confident that we could deal with the surge as it comes if we maintain all the smart things we've done so far on social distancing, hand washing, all of that.
With regard to ramping up testing, which you talked about yesterday, at 20,000 tests per day, it would take probably the better part of a year to test all Minnesotans. You've said critical workers and high-risk people would be prioritized for testing. Do you know how long it'll take to test all of those folks to get a baseline?
That's a good question. I should run the math on that. Jan, you want to say anything on that? That is a good question. I really like the way you frame that up, though, about thinking about how big this task is. And it also keeps you in mind when you hear people throw out numbers. We acquired 1 million gloves. we'll burn through that in a day. So when you hear these numbers, they sound big. They're not. And the same thing with testing. We should, as a nation, have set a goal for, 1 million. I mean, you do 1 million a day, we're at it for a year. And we're not even close. We've done 3 million tests in total.
Thanks. I appreciate the opportunity to just clarify again. We're not saying every Minnesotan needs to be tested. The goal is every symptomatic Minnesotan needs to be tested. And then we get smarter about the use of serology tests for helping do some population prevalence estimates that we don't really have right now. All I've been able to say is we know the tested numbers are the tip of the iceberg, and we need to get our hands around how big is that iceberg underneath. But so the goal of testing every symptomatic Minnesotan, we absolutely think can be met in the next, I'm going to just probably be wrong on this by a factor of something, but at the rate that we're expecting to climb up to, I'm hopeful that we'll be able to, like tomorrow, start testing every Minnesotan that or help get them to the point where they can get a test. So it's not just if they go to one setting, they're told, well, I can't test you. We need to do better than that. We need to get them to a place where they can get tested. So that infrastructure to get people access to the test when they need it is quickly being built. I think we should be able to test all the symptomatic people, again, as they come through. They're not all symptomatic on day one. So the goal is to get to the point where every care provider can get their symptomatic patients tested, really promptly. We're hoping that we can achieve that within the next 4 weeks, that every symptomatic person's able to get a test.
Governor, a couple of questions from my colleagues. One is on the state fair. The GM is saying there's going to be either a full fare or no fare. Are you full fare or no fare at this point?
Well, I think all of you know, the only person who loves the state fair more than me is Lieutenant Governor Flanagan. Those of you know that my plan was, I found out that Ohio, the governor of Ohio years ago had a tradition, and of course Mike DeWine came out because the Minnesota State Fair is much better than Ohio. That is an objective statement, and he knew that. He said that the governor sleeps in the barn the night before it opens, and I said, oh yeah, we're starting that tradition, because then every governor who follows me can sleep in the barn after that. But this is important to Minnesota, and again, we're coming closer to it. We're going to listen to the health experts. We're going to put it on, and again, this is pains me. The state fair falls at the right of the dial. I think we can all see that. I think it's a pretty tough lift. It's certainly at this point in time, I wouldn't make a definitive call, but I also don't want to give any false hope on this. I think it'll be very difficult to see a state fair operating, and I don't know how you social distance in there. I mean, one of the greatest parts of the state fair is it's super crowded, that you're elbow to elbow with your neighbors, that everywhere you go, you just talk to somebody. That's the charm of the Minnesota State Fair a lot of time. Unfortunately, that is the worst thing for COVID-19 control. And so I know they're looking at it at this point in time. I just think it's going to be a hard lift, but we'll hope.
If I can get one other question from my colleagues here. It's about nursing homes. We have 75% of our deaths are now long-term care facilities. A couple of facilities have had a dozen deaths apiece. Is there something the state could have done, especially at those facilities, that could have prevented that or mitigated that? And why are we seeing so many deaths at nursing homes?
Yeah, Jan, I think she's taught me a lot on this. Obviously, the congregate care, also the age, the underlying factors are part of that. We had this conversation too about, we have, I believe, still over half of those have one case. This one is across the country. This is where most of the deaths are happening. And so I'll have you answer the question. We ask ourselves that question too. What can we do to alleviate that, and are there things we should have done?
Yeah. Yes, it is a very fair question, and I know how frightening it is for families to be thinking about this. But keeping it in context, I mean, and again, I don't in any way mean to minimize the importance of COVID, but you look at any of our death statistics, and you'll see the same patterns with influenza, and the like, just as a function of age, of underlying health conditions. Some of these patterns are sadly all too familiar. One thing that we're going to have to do a better job of teasing out in the beginning, and I am so grateful for this, there are some care settings that are called as a matter of mission to say we will take COVID patients as they come out of the hospital. And we will take COVID patients that maybe another facility isn't able to take. The COVID support centers or settings are what we're calling them, and they're being stood up around the state as we speak. So some of the concentration of cases may actually be intentional, that we're trying to create specialty settings for folks to be. In terms of could we have done more, what I can tell you is that it's certainly a challenge. Again, it has to do with the workforce, the pressures on the workforce. We think that most of the spread is introduced by healthcare workers coming in. Certainly the more recent cases after visitor restrictions were put in place pretty stringently. And that's just a real challenge. And that's part of what the new problem we're having is the better job we do screening out ill workers, the fewer workers there are to take care of the patients. And then we have a different problem to try to help solve. But we have a team from CDC in actually this week looking at and advising us on, is there anything more we can be doing? We've been ramping up the infection control practices. There are teams of folks that check with those facilities every single day. It's just a really tough setting to manage. But I'm eager. I haven't seen the CDC report yet, but I'm really anxious to know what else we could do. It's a really good question.
And Theo, I would add, I think your answer to that is for all of us, and again, I lump all of us in decision-making, states and federally. I do think we could have done some things if we'd had more PPE and more testing early on, and we started that before it started getting hot. And again, that's not a blame because we're dealing with it now, and I think every state and federally, that's what happened. We got behind.
Getting a little close on time here, maybe one or two more.
Can I ask a question on behalf of Dana Ferguson, Forum News? This is on behalf of the West Central Tribune. Could you please address the growing number of COVID-19 cases at Jenny O, and is the state advising action there at this time?
Yeah, and I may have labor and health come back up. These are the things we worried about. We knew that the congregate settings of our processing plants was going to be a problem. We see those numbers coming up. I'm going to talk about the team that's out there. So.
And I would invite my colleague Nancy Lepping from Labor and Industry to join. You're right. We're seeing more questions, more concerns about the surrounding counties. It's Nobles, it's Cotton, it's Candy, Ojai. I think we are trying to learn and transmit the lessons learned from plants here in Minnesota, but also in other communities to try to get ahead of. Nancy and her team have been really great at thinking about what are some specific kinds of guidances for these very specific kinds of production facilities that we can anticipate and try to put in place now. And she's done some great stuff to proactively try to seek information from them. If you'd like to comment.
So earlier in the week, we sent out, we've been making in-person contacts, telephone contacts, and email contacts, but also have sent a letter to all of the meat processing plants in Minnesota. One, providing them with the guidelines that we developed with the Department of Ag and the Department of Health over the weekend, but also then asking them to advise us as to the health status of their workers so that we can start to more quickly identify where there may be problems in these facilities so that we can then bring in health and other support for their businesses. I think what we've learned is that this is an industry that is in a kind of a pressure point because they are a critical business. They are meeting the needs of farmers who need their hogs and their chickens and their turkeys processed. So I think what we've learned in that situation is that they cannot operate at the capacity that they were operating at, and that they need to slow the lines. They need to sequence their shifts. They need to take longer on lunch, transitioning from lunch breaks and breaks and in and out of their facility, and also to ramp up the health testing temperature checking and the health assessments of workers before they come in. And also, importantly, they need to look at their incentives for people to come to work sick. So this is another thing that those facilities have done now, is they've changed their incentives. They're actually working to incent their people to stay home when they're sick, changing their benefit policies, changing their access to leave, so that workers are actually going to stay home when they're sick instead of feeling the incentive and often the suffering a consequence of not coming into work when they shouldn't. So there's a recalibration, as the governor's been saying. You know, the dial was sort of full throttle, and if we work on some PPE, we work on some barriers, we do some of these things, you know, maybe we'll be good. But what we've learned in that sector is that we weren't good, and so we need to dial it back. The department and the Deed and Health are committed to working with plants who come to us and ask for assistance and helping them develop that plan, to walk through all of the processes in their plants so that we can then, most importantly, keep them open, but balance that with keeping their workers safe. Because all you have to do is lose half of your workforce and you're going to be closed anyway. So what we need to do is, you know, calibrate that dial better for that industry, working with our partner agencies, Agriculture, Health, and the Department of Labor, and of course, Deed, Department of Employment and Economic Development plays a critical role with UI benefits and other things that also change the help us do that calibration. So that's where we've done.
One follow-up question either for you or for Commissioner Grove. You're putting a lot of trust in Minnesota businesses to put in these plans that will do social distancing, that will achieve what you want to achieve. Is there any enforcement mechanism or accountability mechanism to make sure that it's going to happen?
Yes. My agency, while we have a consultation unit that primarily focuses on providing assistance to small businesses when they come to us and ask them now, particularly in the time of COVID-19, to work with them, but we also have enforcement. And my agency is also looking at how we can use our enforcement capacity to make sure that we have a presence in these workplaces, to be looking at our work comp data. So as we're seeing more, we had 175 claims for workers' compensation for COVID-related diseases. So we see those coming in as health sees issues in terms of clusters of workers, but also as we identify industries that seem to be having more difficulty, it's the intention of my agency to have a presence and to do inspections of those workplaces.
All right, we get around there.
Great. I'd like to thank all the commissioners. Bob Riegelman, folks at Rydell Skates, thank you for making Minnesota your home. Thank you for articulating how important this is. I think, Bob, you could feel the pride, you can feel the emotion as you talked about this. There's so many of you out there that that this matters to. I also want to give a thank you of continuing to build community. I think about mayors a lot, and Mayor Dave Kleiss out in St. Cloud. Mayors have a lot to do to hold their communities together. They're thinking budgets. They have to look at the state. The state says we're looking at the federal government, but they're the ones that actually have the rubber meets the road. And Dave's doing a lot of things out there. He and I talk about once a week, but I noticed, he did not tell me this, but it's a great story. He leads the sing-along of God Bless America out there in St. Cloud, and I want to thank him for that. And as we leave today, it's an important day. The holy month of Ramadan is starting for our Muslim Minnesota friends. I want to wish you Ramadan Mubarak to all of you, a blessed Ramadan, and understand that our communities are strong together. This sense of what it means to be Minnesotan is shining through. Our sense of innovation, perseverance, decency to one another. And I think what we're doing here is we are setting a standard for the rest of the country, how to make sure that we're hitting that sweet spot in the middle of keeping people safe, of keeping our hospitals ready to roll, and thinking about those economic impacts and how we can do better. So thank you all, and we'll be back tomorrow to talk a little more on education. Thank you. Thank you, everybody. Thanks, Commissioner.
Find more local news stories at ccxmedia.org and follow us on social media.